Okay, so everyone, welcome to Make the Barber's Place Live. Today, as you already know, we are going to be discussing issues with baldness and also what to do. Um, I personally, I've seen a lot of people, from full hair and then just in no time. Hello, Mr. Tunde. Everybody. So here we are. So we have Dr. Tunde already joined in, and he's going to be, helping us. He's going to be telling us a lot about what we are discussing, baldness, and also what to do if in case you are seeing signs. Um, your hair may be getting thinner, or maybe you're seeing signs of baldness, and then also what to do if in case you are seeing all these symptoms. So, Doctor, thank you for joining in.
Thank you
Um,
very much, mate.
yes, we'll be looking forward to actually have this interaction with you. Yes,
Okay.
yes, yes. So, please, would you mind introducing yourself to our viewers so that they know exactly who we are dealing with after now?
All right. Hi, everyone out there. Thank you very much for joining the Easter Live. I am Dr. Tunde Adeife. I am a hair transplant surgeon, and I work with Vinci Hair Clinic. Vinci Hair Clinic is a clinic that deals especially with cases of hair loss. All right. Hair loss has become something that has become important in our era today. Everybody wants to look good. Once you're losing your hair, people begin to lose their confidence. And we
Very true.
decided to
Very
step
true.
in right now to see what we can do, help people with hair loss. And indeed, the clinic has made a lot of giant strides, especially here in Africa. Let me say first and foremost, the Vinci Hair Clinic is a global clinic. We have branches in different parts of the world. And about 5 years ago, we decided to come right here to Africa. The first branch was in Nigeria, in Lagos. Then we decided to have a place in Abuja. And then eventually we came to Accra. So we have our clients who patronize us right from Accra, in Nigeria. And not just that, we have people coming in from Liberia, people coming in from Namibia, different parts of Africa. And we have been offering hair loss, hair restoration solutions. So that's a synopsis of who I am and what my company stands for here in Africa.
That is a very good introduction. Like this introduction just tells us everything about you already. Thank you once again for joining me. So,
uh,
just to get into the matters we'll be discussing, me personally, I've been a barber for the past, let's say, 14 years, and I've seen
that's great.
a lot of people dealing with these issues of baldness. Sometimes you see the people and they have full hair, and after a few years, you see the people's hair getting thinner, and also
Mhm,
some of them we believe it's genetic. Some of them we don't know what the causes are. So, whilst you are
mhm.
the professional, we want you to also be able to explain to us what are some of the causes of baldness, so that we get to know if in case we see those coming symptoms.
Right. So to just make it simplified, the causes of hair loss can be basically divided into two broad areas. Okay. The first one is the genetic form of hair loss or the inherited form of hair loss, while the second one is acquired. Acquired means something led. There's something, the course of the person's life, an action, a habit that led to the hair loss. So let's talk
Okay.
about the first one, the genetic form of hair loss. Genetics simply means it's not your fault. It was passed down to you. It was inherited. Dad is bald, grandpa is bald. Then it's possible. There's a 90% chance that you also will be bald. This happens. If you look outside, if you pick 10 guys, you see that eight of them are having this so-called genetic form of hair loss. All right. Now, in the men, we call it the male pattern baldness. We call it male pattern
Okay.
baldness because it has a certain pattern. There's a certain way
Okay.
to
Yeah.
identify it. All right. When you look at a person's head and you look at the corners, there is a
Yeah.
slight recession. It begins to
Yeah.
go backward in the corners. And it doesn't
Yeah.
just disappear overnight, of course. You begin to notice that the hair, which was initially thick and black, begins to
Yeah.
become thin and thin. From
Yeah.
black, it begins to turn kind of grayish.
Brownish.
It becomes
Yeah.
brownish.
Yeah.
Yeah. I mean, the term I usually use for my clients is baby hair. Strong hair
Yes.
becomes
Yes.
baby hair, transforms into baby hair. When you see that, you already know that, bro, this person is already having male pattern baldness. And not just the front. For some people, it starts with the center, that crown area.
Yeah.
Already the middle of the top here, you see that it begins to thin out the same fashion. It begins to transform from thick hair to baby hair. And in some people, it starts with the front and the middle all at the same time. So these are the
Wow.
early signs of male pattern baldness in the men. In the females, there's something called the female pattern hair loss as well. Right? The female pattern hair loss presents as hair loss in the midline. All right. In this midline, the hair again begins to thin out. It begins to thin out from
Okay.
thick hair to baby hair. Now there is a hormonal play here, in the men especially, where a certain hormone called DHT. You don't need to bother yourself about all the medical stuff. All right. So the hormone, once the person attains the age of puberty, begins to mediate these changes, and the hair begins to thin out. So these are the early signs of the genetic form of hair loss, both in the men and in the women. Thinning. All right. So guys, you need to remember the word thinning. If your hair begins to turn to baby hair, you probably want to consult a hair specialist. Now let's talk about the acquired form of hair loss. Acquired means
Okay.
you did something went wrong. The
Okay.
very, very common cause is the hairstyles. Let's pick the ladies, for example. Many ladies
Okay.
like making these braids, and the
Ladies, please
braids,
listen. Please listen, ladies.
our ladies, please pay
Please.
attention. Many of them prefer to do these tight hairstyles. And these tight
Okay.
hairstyles, unfortunately, they keep pulling the hair and pull. Over time, it uproots the hair. Once the hair is uprooted, honestly, there is no kind of cream, no kind of concoction you're gonna add. Some people say they want to try onions, they want to try a mixture of bananas, they want to try a mixture of tomatoes.
Not to cut you, doctor. Not to cut
Yeah,
you, doctor, but what they
yeah.
tell us is that when they pull the hair, when they go for the braid and the braid is tight, that's how come it forces the hair to grow faster. Is that all? Is
But
that not?
unfortunately, this is not true. You can consider a
Oh,
plant, all right, that is in the soil. When you pull,
okay.
you pull, you pull, at some point you will uproot. This is the
Yes.
same thing with the hair. The hair has a
Okay.
shaft which you see above the skin, and it has a root which is inside the skin. If you pull
Okay.
and you pull and you pull, eventually you might be successful in uprooting the hair, and that creates patches of hair loss. And now you might have probably noticed some women, the frontal hairline is already depleted of hair.
We
This
deal with
is
that
called,
every day.
oh yeah, this is called
Yeah.
traction. Traction means pull.
Okay.
Traction alopecia. All right.
Oh,
And
okay.
even in some guys, there is a
Yeah.
case of traction alopecia as well. Now let's talk
Wow.
about people that like to look funky. All right. They want to use relaxers. God has blessed us with
Yeah.
African thick hair. But some people want to look like the Asian, the Caucasian, they want to look like the European, they want the straight hair. So they get the relaxers and they apply it on the hair. Well, unfortunately,
Okay.
when you apply this, it burns the hair. And in the
Yeah.
process, some people actually feel it that this relaxer is burning their scalp, but they
Okay.
endure it simply because they want to look funky, they want to look European. And the sad part is that continuous use of these relaxers, which burn the scalp, causes the
Okay.
scalp to transform from normal tissue into scar tissue. And eventually,
Wow.
that area, the skin cannot support healthy hair growth, and something called scarring alopecia develops. This is common, very, very common in Africa. I've seen lots of this in Nigeria, and I've seen lots of this in Abuja. We've handled cases, in Accra as well. We've handled this kind of cases. So that we can call scarring or cicatricial alopecia, right? Now, another thing is this,
Oh, okay.
medications. There are some medications that some people take which actually cause hair loss. A
Okay.
common one is those people who have maybe cancer and they're trying to use medications to suppress the progress of the cancer.
The hormone.
Unfortunately, the hair is a rapidly developing cell. It's going to cause the hair also to be depleted. So in these people,
Okay.
after a while, it's possible that they could have their hair restored naturally, but in some other cases, they have to see us and we need to do something about that. That's the case of medications for cancer. Other medications, even some blood pressure medications, can cause hair loss. So we need to be wary of this. You might want to ask your doctor, or you want to read the pamphlet inside the medication for the side effects of that medication.
I mean,
Another
this
thing is,
pamphlets are normally too long, and then sometimes you can't finish reading it all. So sometimes you just
well,
probably listen to what the doctor says, and you just go and take it.
yeah, I mean, if you can't ask a lot of questions, if you are weary to read, you might just want to ask that important question. Doctor, what are the side effects of these medications? And the doctor is
Yeah.
obliged to definitely tell you. Now, something else is food. If you don't, the
Wow.
hair contains about 80%, 80 to 90% of protein. If you don't have enough protein in your food, you can expect that your hair is going to eventually lose its thickness, lose its strength. That happens a lot. All right. So for those people who are vegetarians out there, you need to be careful. Be sure that you're having protein. You're having maybe soya milk. You're having beans in your diet. Then
Mm-hmm.
illnesses. All right. Some people have some certain illnesses that cause hair loss as well, like diabetes. All right. Diabetes is a disease that causes blood supply to some certain regions to be reduced. The hair also inclusive. If the blood supply is not enough, then the
Okay.
hair is not getting enough nutrients and the hair begins to fall off. All right.
Wow.
Then also we also have some practices. Maybe the use of certain hot combs can cause the hair to break as well. Then also a lifestyle situation, stress. Many
Wow.
people go through stress, not necessarily from work. Maybe they just lost a loved one. They're
Yeah.
going through something difficult at work, a student, for example, studying for an
Yeah.
exam. Um, Stress can cause something called stress-induced hair loss, otherwise called
Wow.
telogen effluvium. All right, so we need to be real about this. The summary is, if you notice that the hair is falling off, the hair is depleting rapidly, you might want to consult a hair specialist. So it's a broad topic, but I think this.
This is a lot though. Like this is like it's like almost everybody can actually experience this issue. I mean this
Oh
hair
yeah,
loss issue because from all the explanation that you just gave, it means like and like it looks like everybody has some sort of like connection to all these explanations. Like either you are not
yeah.
eating well, you can actually lose your hair, whether you are using all these chemicals, which I personally my experience in the business for all these years, I advise people not to like constantly use certain chemicals. And also there are some chemicals that are on the market that are not like uh, quality, and all those
Hmm.
chemicals also have they don't have proper prescriptions and also proper guidelines how to use it. And also there are a lot of people who are in the beauty business also that don't really know what they are doing. You know,
Yeah,
like the fact that the person cuts hair or the fact that the person owns a barber shop doesn't mean that the person knows what they're about. So I
yeah.
feel also like those also can be also like some aspect of the hair loss. I mean, that could be causing the hair loss. Because I always
You're
advise
right.
my client that using of chemicals, there are timelines where you can use a certain chemical. You can't use it within that. I mean, more than that. I mean, that space that you've been given to use it. Like, let's say, for instance, there are some chemicals that they say you can only use it in like 3 months, every 3 months. You can't use it like within 3 months. So let's say if you use it
Mm,
today, the only time you can use it again is to be in another. But I see
yeah.
other people using it like constant, and this is like every 2 weeks or every 3 weeks. Can this also like cause like this hair damages or this cells? Can it also cause this cells damages?
Yeah, I mean, I'm not disputing the fact that product out there that to be used, but you raised an important point, the frequency of usage. Some hair products
Yeah.
should not be used like every time. It should not be used every month, but we'll find people who are breaching this important protocol. They use this stuff like every month. Some of them using it every week even, and of course, the consequences are the loss of hair. Yes, all right.
Wow. 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 So doctors, I want to ask, so
Mm.
is there a treatment for this hair loss? Is there, I mean, can people actually treat the hair loss issues? Can they actually regain their hair back? I mean, if in case they see these symptoms, or maybe if somebody who has lost the hair totally, can they actually get their hair back if in case they want to actually come for this treatment?
Right. So if it's the genetic form of hair loss, like in the guys, for example, in the early stage, when the hair is just thinning out, there are medications
Okay.
that can be used to be able to revert the effect of
Okay.
this hormone that causes hair loss. And these medications, of course, are available in our clinics. When you come in, we consult with you and we give you the medication that is adequate for you. Now, for some other people, they have waited a long time. Some people actually are in denial as they hear things else, they feel it's going to come back, but it doesn't come back. And after a while, a bald patch appears. For those
Yeah.
people, if the hair loss is minimal, when I say minimal, that means if the patch is not so big, we could
Yeah.
do something very great for them is called the hair transplant. Now, the hair transplant is an innovative surgery in the medical field where we can take active follicles from one area,
Okay.
usually the back of the head, and we can place them in those balding areas. And in a couple of months, these hair follicles begin to grow and they fill up the bald area, and that person regains the hair. This is the wonder, this is the magic of the hair transplant. All right. Now, for those people who have lost a lot of hair, all right, if the hair loss has been so extensive, like those guys who have lost hair up to the back, for those people, if you don't have sufficient donor hair, all right, you might be wondering what kind of hair is sufficient. Let me not go into that. You just have to probably consult with us, send us photos, and we can tell you if it is sufficient. If it's not sufficient, a hair transplant at this point might not be possible. And we'll look at something different called the microscalp pigmentation. It's essentially is a scalp tattooing technique where we put dots on the scalp that look like hair. And with this, we can help a person to recreate the hairline. If you go check on our Instagram page, Vinci Hair Ghana, you'll be able to see before and afters how these procedures are being done. So the microscalp pigmentation
That is
helps.
so amazing.
Yeah, so we also have some other adjunct treatments like the platelet-rich plasma or the PRP. We have the mesotherapy. We have the corticosteroid treatment. So there's a wide range of treatment. But we have to treat based on the diagnosis. What is the cause of the hair loss? That's the first thing we want to know. We want to know what is the extent of the hair loss. All right, because that would tell us if we're going to be doing the surgery or we're going to be doing the microscope pigmentation. So indeed, there are a couple of treatment options available to people who are suffering from hair loss.
Wow. Wow. So
Yeah,
that means there's actually hope for somebody who has already lost their hair or somebody who is on the way to lose their hair. There's actually
there
hope.
is there is hope. There is hope, and I would like to emphasize the earlier the better. The earlier you consult us, the better for you.
The better. The better.
Yeah.
So I heard you saying that when the person starts seeing the symptoms, right, and then they come, you don't necessarily have to like um, um, do the surgery, but you have like medications that you can give to the people, and then they can
Hmm.
regain their hair back, and it reverses the baldness.
Yeah. Yeah.
Is this also for the people who are genetically, who are going bald genetically, or is just for people who, due to some chemical usage, they're experiencing it, or it's for everybody?
So it's basically for all the classes. For those people who are genetically losing their hair, there are medications available. For those people who have used chemicals, again, it depends on the stage. There is the stage
Okay.
1, the stage 2, the stage 3. If it's at the early stage, we can use medications. If it's at the later stage, we might have to think of doing the surgery or having to do the microscope pigmentation.
Okay, so
Yeah.
please, if you can actually explain it so that our people will be clear, because I see our viewers are a bit quiet, and viewers, you guys can actually ask questions, and doctor will be willing to explain whatever you want to know, or maybe whatever you would want him to explain. You guys can actually ask anything that maybe you feel like you're not getting it clear. But I have a few questions here that I want to ask on our behalf, on my behalf, on the viewers' behalf. So, what is the I heard you said the transplant and then MSP, right? What is the
Hmm.
difference between these two?
Okay.
Yeah.
Now, the microscope pigmentation is essentially a scalp tattooing procedure. Now, we don't use the normal ink or dye that is used to make tattoos. We use
Okay.
medically graded pigments that are very, very
Wow.
tender to the skin. All right. So what we do is we make dots. No, when the person barbs the hair,
Yeah.
skin cut, and you look at the
Yeah.
scalp, it actually looks
Yeah.
like you're seeing dots all over the scalp.
Yeah. Yeah.
Now, this is the logic. So we employed this and we decided, why can't we put dots on the scalp? So if a person even
Okay.
has lost all the hair, instead of that shiny, you know,
Yeah.
clean
Bow. Yeah.
scalp, let's put dots on the scalp. So we decided, let's put dots on the scalp, let's recreate the hairline in front. And then when we do this, when we look at that person, you just simply think, oh, this person has a skin cut. So he's not perceived as
Okay.
a person who is bald. He's perceived as a person who had a skin
Yeah.
cut. And trust me, this is way better than being perceived as a person who is bald. Such way, the
Wow.
person regains his confidence. Right? That is the micro scalp pigmentation, the scalp
Okay.
tattooing procedure. The other one
Okay.
is hair transplant. We patient, we can take alive follicles from a donor area, typically the back of the head, and we take that, all right, and we put that into the bald areas. When we plant, what we make sure, the important part is we put the roots into the skin. When we put the root into the skin, in a couple of months, the root is activated and the hair begins to sprout out of that area, and you can see different hair shafts growing out on the scalp. And then you see that the bald area eventually becomes covered up with natural hair again. So the hair
Wow.
transplant gives natural hair to a person who was formerly bald, and again, the confidence is restored. So that's basically the difference between the two.
Wow. Wow. Wow.
Mm.
That's good. But also, I'm sure I would want to know like is there a way who somebody who has done the MSP can still
Hmm.
do the transplant? Is it possible? If in case maybe
Yeah,
the person feels like okay, the person feels like maybe oh I think I like the
the
tattooing
MSP.
and all that. It
Hmm.
looks good, but right now I want to actually have more hair. I want to grow hair. I want to actually have like some styles, changing of styles and all that. Because I believe like if the
Hmm.
person does the MSP, that means that's just the haircut. That's the style that you're going to have. But would if the
Yeah.
person feel like oh I want to change this style, I want to change how this looks. Is it possible for the person to do the hair transplant after the person has done the MSP?
Yeah, I mean, I like what you said, their style. So some people, most Africans, actually
Yeah,
like a skin cut. Even those people who have hair, some people prefer to go around with a skin cut. In
yeah,
such people, sometimes they come to the clinic and they tell you, I know a hair transplant is a good option for me, but let me have the microscopic pigmentation now. We do the
yeah.
microscopic pigmentation for them and they go away, they rock it for like maybe 1, 2, 3 years. And at some point they come and like, doctor, I think I want to have the hair transplant done now. In such people, if the extent of hair loss is not too much, if the donor area is still sufficient, all right, for us to harvest enough follicles, yes, we can go ahead. So a person who has previously had a microscopic pigmentation could actually have a hair transplant in a couple of years. His choice.
Wow, wow. I mean, this is very clear now. I mean, we are learning a lot, and thank you for how you are taking your time to actually explain everything, and also you're making it very clear. And even somebody who has not even heard about this before, I'm sure would just
Mm.
understand from the way you are explaining it. Yes. So, doctor, can
So
you actually tell us is there any side effect from any of this? I mean, either the transplant or the MSP. Are there any side effects?
that's a good question. Like I said, with medications, people need to ask the doctor if there's a side effect. All
Yes.
right. For the hair transplant, honestly, we will be talking about side effects if we were using hair from a different donor, that's from a different person. But in
Oh,
our
okay.
case, we use the person's natural hair. We use
Oh.
your own hair to help
Mm.
cover the areas of baldness. So within the entire procedure, honestly, there is really no side effect that you should be expecting because we are using your own pre-existing tissue, your own pre-existing hair to recreate your hairline. All right. For the
Wow.
microscopic pigmentation as well, I mentioned that we use medically graded pigments. They are basically plant extracts that have been known to be, let me use the medical term, hypoallergic. That means they create almost no form of allergic reaction to the skin. They are very skin tolerable. This is what we ensure that we use this kind of pigment, especially in our clinic. All right. So that's what we place on the scalp. And really, again, I have practically almost not come in contact with somebody who reacts to the pigment. Uh, is the MSP painful? The question I'd like to ask you, is the tattoo painful?
I
When you're
know,
having a
right?
tattoo, is it painful? Right. So I'm
I
not going
mean,
to tell you that.
when it comes to beauty, everybody want to go for it. Everybody, they say no pain, no gain, but when it comes to
You
something
got
else,
it.
everybody like
Hmm. All right.
yeah.
So honestly, the MS, but we use something called a no pain cream. It's a lidocaine based cream that helps to numb the scalp to a great extent, so that even during the MS procedure, our clients are comfortable. And I've walked into the MS bureau sometimes, and I've seen that some clients are practically playing with their phones. Some of them are even falling asleep while we're having the entire procedure. As for this
Wow.
hair transplant, yes, you might be wondering, is it painful? Yeah. So we use a local anesthetic. We inject the areas we want to work on. Of course, when the needles are going inside, you might feel some slight discomfort. But once the injection goes in, it numbs that area. And during the process of the hair transplant, the clients can be relaxed while we can be doing our work. Trust me, I have some clients that come with their Netflix account and they're watching movies during the process. Many
Wow.
clients actually, even the ones from Ghana, when they come to Nigeria, we end up exchanging cultural information. They're telling us what is obtainable in Ghana. They tell us about the banku. They tell us
I know.
about the food that you
The
have there,
Ghana
all the
jollof
food.
and the Nigerian
Yeah,
jollof.
oh, but there's a lot of arguments right there in the theater. That's just to tell you how comfortable they are during the entire
Wow.
process. So, yeah, I have lots of friends right there in Accra, people who have come to our clinic. And we still have people who plan to come. If you check our calendar, even for this month, for next year, we have people who have already booked for surgery. So, yeah,
Wow.
it's kind of the side effects you're worrying about. Honestly, they're practically not there. To be honest with you.
Yeah, doctor, if you can
Yeah.
also tell us what's the process? How long does it take to get a transplant? Like, how is it daily, or it's a period of time that you have to do it? Is it how does it is it what's the timeline for it? How does it happen? How do you do it? How do you go about it?
So the hair transplant is a day procedure. A day
Oh,
procedure.
okay.
All right. It takes about 6, 7, 8 hours, depending on the extent of hair loss. But it's done in one day. You come in the morning, we take out the follicles, then we sort it out, and then we begin to plant. So it could take like 6, 7, 8 hours.
Oh, that's not bad because we were
Mhm.
thinking that it's something you go back and keep going back and forth and then to get it done. Because of when you hear the name the transplant, it's like it's a lot of work. So I mean, thank you for also explaining that. And also,
Mhm.
what I mean, how do you? I mean, because I feel like a lot of people, because I personally, I mean, recommended a lot of people to Vinci Ghana, and also anytime I recommend people, I realize that they have this fear. Why do you think people are still scared of hair transplant, and also when it comes to anything that has to do with surgery or transplant or anything? Why are people still scared? Why do you think people are so scared of that, though?
So, all right. So there is always the fear of the unknown. What you don't know, what you're not sure of, if you have not tried it before, definitely you will be afraid. You'll be cautious. All right. When you mention the name surgery, actually, people are always worried. Oh, pain. Is it going to hurt? What are the side effects? But once again, this is the reason why we need to educate people. And I believe this is one of the reasons why we're having this Insta Live, so that people can know that this process is relatively safe. All right. People come in, they have their procedures done. We don't use the risky form of anesthesia called the general anesthesia, where people fall asleep throughout. We use the local anesthesia. Most of our clients are awake throughout the procedure.
Wow.
Like I said, we engage each other in conversations. We actually end up having a wonderful time right there in the theater. We are chatting, we are discussing, talking different topics. All right. So generally, people will be afraid of the unknown. That is why they need to be educated about the safety of the transplant and the success rates. They need to know that these procedures are relatively safe, they are friendly, and basically there's really nothing to fear.
Wow, that's great. That's great.
Yeah.
That's great. I mean, you've answered all our questions. Like, I mean, even the ones we didn't ask, you already answered it. You already answered. So,
Yeah.
so, what would you tell? What would you tell our viewers and everybody out there who are experiencing this? What would you tell them? I mean, from listening to this interview, what would you tell them?
All right. So what I'll say is this. For everyone out there, we already talked about the symptoms, the early signs of hair loss. All right. If you find yourself having this kind of situation, you should speak to a specialist. All right. We have outlets out there. There's on the Instagram, they can always reach us out, Vinci Hair Ghana. And our numbers are right there on the page as well. They can contact us, send us photos. We can give assessments and we can tell you what to do. So what I'll basically say is the advice is if you're experiencing any form of hair loss, do you want to contact us right here at Vinci? And definitely we'll be prompt to respond to your request and we can tell you what the cause is and what you have to do. All right? That's basically what I'll advise everyone. And don't be scared of the surgeries. Trust me, it's a safe procedure. You don't need to be worried so much about it.
I see a lot of people are asking about the pricing and they are talking about the prices. So
It's a
I
good
mean,
it's a good discussion. It's a good
yeah.
question rather.
I think
Well, I
I
mean,
mean
like we said,
yeah.
if we
No, go ahead.
consider the cost of a hair, if we consider the cost of a hair transplant, and you check out there in clinics in the UK, in the US, you might be looking at even as high as $10,000 or even higher.
Wow.
I've known people who
Wow.
have gone to do transplants for 15,000 US, right? But when we came to Africa, we decided to give a price that is affordable to our clients. All right. So at
Wow.
this moment, a transplant is in our clinic is 4,000 US dollars. And I will
Wow.
tell you this even as a secret. That sometimes when people come in, we from maybe during the festive periods, like during the Valentines, maybe during Christmas, during Easter, we can decide to throw in a bonus just to help people who initially found it difficult to make this payment. But I can tell you one thing: when you calculate how much it's going to cost you to go to the US, to the UK, to Australia, or to Turkey to get your hair transplant done, it's going to be way, way more expensive. And again, you are coming to a place in Africa, all right? So the transport is not so much, all right? You're coming to Nigeria to have a transplant done, and the transport is not so much. So indeed, when you calculate all the expenses, we are actually uh, breaking our backs here to make it affordable for people. All
Wow.
right, even the microscalp pigmentation, we are making it affordable for people to afford, for people to be able to get it done. And one other thing is this: in Africa, all our clients are basically Africans. They have the African hair. We deal with African hair. If you go abroad, you might not find a person who specializes in African hair. The structure of the
Yeah.
African hair is different from the structure of the Asian hair, Caucasian hair. So you might want to talk to a specialist that deals with African hair. This is why I'll tell you, come to Vinci Hair Clinic, and I tell you, we have years of experience. We have had thousands of consultations. So Vinci Hair Clinic basically is where you need to
Wow.
go. Yeah.
Wow, wow. So guys, I mean, you guys are ready for yourself. I mean, I believe everything that if in case you're looking for something and you're looking for something good, you should know that there's definitely some cost involved also. And also,
Yeah.
if you really really want to change something about yourself, you should be really, you should be willing to pay for, what it costs.
Yeah.
And also,
Yeah.
I think, the price, like looking at the price difference. I mean, this is two. The difference is two, even, vast, and there's like even you're just doing it for almost nothing. It's like you're just
Yeah.
giving it almost for free. So
Yeah.
I mean, wow, that's amazing. That's amazing. That's amazing. So guys, if you would want to ask, some personal questions, you guys can just go ahead and ask. Because for me, all my questions are already answered, and I don't even know what else to ask the doctor. So if you guys have some personal questions that you might want to ask, or maybe there are some questions that I didn't ask, and you guys might want to ask, you guys can just go ahead and then ask the doctor, and then he might give you a better explanation. Because a lot of people come to the barber shop and then they be like, oh, give me some cream for my hair, and then this, and I'm like, okay, cool. So we have, as you just explained, we have types of baldness. So it depends on what you are dealing with, and also what we can actually advise you to use. So we've directed so many people to, Vinci Ghana, and then, they came out,
Okay.
smiling. Recently,
Okay.
yeah.
That's
So
great.
one of the issues that we just dealt with recently was a lady who had the whole of, her middle part of her hair. It was gone. It was gone
Oh,
as of now. So this was like 6 months ago. That was just after COVID, right? And then
yeah.
I actually directed her to Vinci Ghana, and trust me, she came to me last 2 weeks, and she has braids. I was like, what happened? She was like, nah. So like, she has braids, so she now has braids in the middle. That was gone, and she now gets a haircut on the side. And I was just so amazed. So as for me, I believe in it. So one of the things that I've whenever I'm recommending people to look into these services, is that I realize that they feel like they don't have the trust for the I don't know why. Why do you think the trust is so low when they have to do it in Africa, where it's our own? I don't know why. Why do you think the trust is so low in people when it comes to dealing with our
Well,
own people?
you're asking me a very political question, and I'll simply say, even when you have people who are performing excellently, amongst them probably you have some people who have spoilt, the name. But I still believe in in the African continent. I still like, for example, what you're doing. You don't have to go to the UK. You don't have to go to the US to get a great haircut. I go on
Yeah,
Instagram and I see barbers in the UK doing great stuff, US doing great stuff. But right here in Nigeria, you have barbers
Yeah.
who are great, who are artistic, barbers who are skillful, and who make the job, look easy. That is one of the things. I've gone through your page and I've seen the wonderful stuff that you do, and I'm like, wow, So
Thank
people
you so
like
much.
you, people like me exist here in Nigeria, and
Wow.
people in Africa, in Ghana. I mean, so people need to know that Africa still has something great to offer. I mean, I'll tell you one personal experience. I studied in Russia, all right?
Wow.
And while I was
Yeah.
in Russia, I studied with Russians.
Wow.
Right there in the class, the top 5 students were Africans. I
Wow.
mean, we had some Russians, but we had Africans. Look at the US when people go abroad to study. In the universities, when they are giving out, certificates to first-class students, you
Yes.
will see an African or two or
Yes.
three out there. Go check
Yes.
it out. Africans are making names in the world. We are known for excellence, and
Amazing. I mean, you said
people
it
need to
also.
know this. We Africans have a lot to offer. I mean, I
Too,
don't know how it is in Ghana. Don't you have doctors who are migrating out to the UK they are
there's
doing
too
great
many.
job.
Too
Yeah.
many. And
So
even I was discussing, not to cut you, I had an interview with an American TV station recently, and I was telling them like Africans have like the potential in Africa is so much, and then the talent and the wisdom in Africa is just so much. It's just for us to just believe in ourselves and know that we are capable, right? And I think that a lot of us have lost our identity of being as great as we are. So we don't. That's how come the confidence in ourselves has come down. So I think this is a time that we need to start believing in ourselves and know that we also know how to do things and we can do it better, right? Because
sure.
I personally, I believe in the Africans, and I believe that Africans are one of the greatest. I mean, humans that have live on this planet. So everybody that is watching, the doctor has said it, I've confirmed it. We Africans have the potential and we are great at whatever we do. Because I think at the end of the day, it's just the individual, how much you're willing
True.
to put into what you're doing. That will determine,
True.
the outcome of whatever you are
Boss,
doing. So, I
that
mean,
boss said.
let's start believing in ourselves. We have great doctors who have studied in Russia and to be part of the top 5. I mean, you guys should understand. I mean, yeah. So, I mean, you said it all, doctor. So, I
Yeah.
mean, I see some questions. Some people are still asking about the prices. All of you asking about the prices. We've already discussed the prices. So after this video, Vinci Ghana, Vinci Nigeria, Make the Barber Place is going to post all these videos. These videos on all our pages. So you guys can just go back and just watch and see. What you missed,
Exactly.
any questions, because all the questions that are coming are already been answered. And also we wouldn't want to keep our doctor. As you guys can see, you can see that it's in work. He's ready to do some work. So let's not keep doctor for too long. And then also,
Yeah.
like, doctor, we appreciate you for actually taking the time to talk to us about this important, topics, and also explaining things the way you explain it. You explain it so clear. You should be teaching people, like, because your explanations are changing. You should have a school.
Thank you so much. I'm humbled, sir. I'm humbled,
You're
Mr. Nate.
welcome.
I'm
You're
humbled. Yeah.
welcome.
And great job you
So
are doing right there in Ghana. I mean,
thank
your
you so much.
barbering services, the quality of the salon, I want to say it's a good one. It's top
Thank
notch.
you.
It can compete with any international barbering salon. We have
Thank
great
you.
barbers in Nigeria. And I'm going to
Yeah.
say, I mean, Nate for barbering president, whatever it is.
We are grateful and we're also like very honored and also like we appreciate
Yeah,
it. And we are just trying to just be the difference, and also just put in what we have to put in to also get
sure,
to give people the result they are looking for. And one
sure.
thing to that I want young people to know is that a lot of young people like cutting corners too much, they cut
Mm-hmm.
corners too much. So that's how come like we have very few people who are actually succeeding. Everybody can
Mm,
succeed, that I believe, but if you keep cutting corners and you keep trying to get things fast or get things done quickly. That's not how I've been in this barbering business for since 2006. A lot of people, when I say that, a lot of people be like, "Oh, how old are you?" Yeah, I've been around for a long time. So I started doing this like very young. So since 2006, I've come to understand a lot, and also I've come to get a lot of experience, and I've understood that it's only hard work and also like putting in your all that will be able to put you on a level. Nobody is
Mm-hmm.
anywhere by mistake or by chance. Everybody that you see at a certain level in life is actually putting in some amount of work. That is why they are on that level. So, I mean,
Yeah.
I just want to tell all the young people and all of us. So, if we start putting in, the amount of work some of us are putting in, we will start believing in ourselves as Africans. You know.
Mm-hmm.
So I think that's something that I would like to tell all our viewers and all the people that every young person, so that we just believe in ourselves. You know.
Yeah,
I
sure.
mean, Doctor, I don't know if you want to add anything to that.
I mean, you said it all. You said it all, and I'll just simply say because some other people will probably come back later and they want to still ask questions. Of
Yeah.
course, we cannot be here forever. But what I will simply say is that they can contact us on our Instagram. It is Vinci Hair Ghana. Send us a DM. If you check in the bio, the numbers are there. And actually, we
Yeah.
have a clinic in Accra. It is actually opposite the Gethsemane, what's it called,
Gethsemane.
Gethsemane Memorial Gardens. Yeah,
Yeah.
it's on Boundary
East
Road,
Legon.
Shiashie. Yeah,
Yeah.
East Legon. Yes, that's
Yeah.
exactly where it is. So you can walk into the office and you can have a consultation, and our consultation actually is free. It's
Wow.
free.
Wow.
Yeah,
Wow.
so please feel free to contact us or physically come into the clinic, and we will be glad to help you out with any questions that you have.
That's
Yes.
very nice of you. That's very nice of you, Doctor. We thank you once again
Yeah.
for the way you
Thank.
explain things is just so nice. You know, I admire you for that. Like your explanations are
Thank.
just so nice and it's just so straight to the point and it's just so perfect. So as
Thank you,
Doctor
sir.
said, so Vinci Hair Clinic is in, Vinci Hair Clinic Ghana is opposite the Gethsemane Memorial in East Legon. It's on the boundary road from Shiashi to East Legon. Yes, it's a very accessible place, right? So, and also
Yeah.
if you're looking at getting the best haircut in the whole country, I mean,
Of course.
this is the place to
Of
go.
course.
The barber's place is like
Of
we give you the top quality service. So, I mean,
yeah.
guys, I mean,
Yeah.
we want to say thank you to Doctor for actually giving this. I'm giving us this insight of what I mean people are dealing with, and a lot of people, almost everybody, almost every young person now is actually dealing with this baldness issue. So now that we know that
Mhm.
there is a cure and there is a treatment and also there is a preventive measures that we can actually take, I mean,
Yeah.
everybody should just jump on it and let's just make it. Because I mean, nobody, doctor, if you see the transformation between somebody who has hair and when the person starts losing their hair, it's too ridiculous. Like it's
I
it's
know. I
it's,
know.
it's too much. The
I
confidence that
know.
the person will lose, I mean, it's just too much. So I mean, as for me,
You're right.
I advise everybody not to like lose your hair. You know, as you can see me, I'm full, I'm sorted.
Great. Great.
Yeah. So guys, I think our questions are answered, and we just say thank you very much once again
All
for
right.
having given us this time. So God bless you. We would look forward to have another time like this with you so that we explain more and also give us
Thank you.
more details on what to know. Thank you
No,
so much,
no
Doctor.
problem. Thank you too.
All right. So have a
All right.
nice evening.
Have a
Yeah.
nice evening too as well.
All
Bye,
right.
everyone.
Bye bye. All right, so guys, as you already know, this was amazing. You know, thank you to every one of you who joined in and you made this amazing. Um, as you already know, if you want to only Nate the Barber and Nate the Barber's Place, the whole Nate the Barber's Place team, we just want to say a very big thank you for you guys for supporting us. You guys have always been supportive, you know, and some of you have been you've joined this for 49 minutes, and I appreciate you guys for the love you guys have shown us. This is amazing. So we just want to say, if in case you missed any of the questions that the doctor answered. Okay, so I mean, if you don't know who we just had the discussion with, that's Dr. Tunde Adefe. He's the only uh, hair transplant surgeon in West Africa. You know, and he's doing amazing. So guys, the questions that he answered, that's it. You don't need any other questions. That's it. So if in case you didn't get some questions answered, or if in case you didn't get some answers properly, you can just go on their page, Vinci Ghana. Vinci Ghana, I'm going to tag them after this video so they just see what other things that you can know. You can actually check their page out. They have 3 branches in Ghana. They have, in Africa actually. So they have Nigeria. They have 2 in Nigeria, 1 in Ghana. So guys, as you already know, when we talk about it, you should know that it's legit. You know, we don't come and talk about nothing that is not serious. So we like to do things serious. So we talk about somebody or we associate ourselves with somebody to know that that is, I mean, the people are also like some serious people. So Thank you guys once again for joining in, and God bless all of you that joined in and supported this. If not for you guys, it wouldn't have been a success. So stay fresh always. Nate the Barber's Place, we love you. We say God bless every one of you for making this a special one. We appreciate you guys. Mr. Michael, I'm sorry, but I'll accept the next request. Okay, so I see everybody. Nicole, I see you. I see everybody. Like, God bless all of you guys. Unfortunately, we have to end our section now. Uh, Okay, so DJ Equa. Okay, so you can just DM us and then we'll get back to you in our DMs. That's the easiest way. Our contact is in our bio. If you click on our page, you go in our bio, you see our contact. You can call us. You can call us directly also, and you get to us. So whatever questions and whatever inquiries you want to make, you can make it through that either in our DMs or you can contact us directly. Thank you guys for supporting us once again. Stay fresh, look good all the time. You look good all the time. There is one thing about looking good all the time, You never know when you get into any, you know. So looking good, it's a must. Okay, so stay fresh. Need the barber's place. Need the barber. I'm out. You're welcome, Ikea.